NIPAH virus.
NIPAH virus is a member of the family Paramyxoviridae, genus NIPAH virus. NIPAH was first seen in Malaysia in 1999 and initially thought to be Japanese encephalitis. This outbreak had signs and symptoms similar to encephalitis and respiratory illnesses and was identified among pig farmers and people with close contact with pigs in Malaysia and Singapore. Its name originated from Sungai Nipah, a village in Malaysia where pig farmers became ill. This disease reappeared in selected districts in Bangladesh in 2001, but it had different signs due to different strain of Nipah than one in Malaysia. Given the relatedness of Nipah to Hendra virus, bat species were quickly singled out for investigation, and flying foxes of the genus Tropis were subsequently identified as the source for Nipah. Outbreaks occur primarily in December and March, since this is the season that date palm sap is being collected. Scientists have found that as the date palm sap drips from a tree to collective pods, fruit bats drink the juice and may contaminate it with their saliva or urine. Also, other species can be contaminated with this virus from direct contact with the palm sap or fruit or being in contact with any other contaminated animal. According to World Health Organization, outbreaks of Nipah has occurred among Southeast Asian countries. Countries such as India had their most recent outbreaks in 2007 and in Bangladesh in 2012.
The Nipah virus infection can result in symptoms from opposite ends of the spectrum, from a patient showing no symptoms at all to a patient going into a coma within 24 to 48 hours. This infection has a death rate ranging between 40 and 70%. Initial signs of the Nipah virus infection include flu-like symptoms such as a fever, sore throat, muscle pain, headaches, and difficulty breathing. Encephalitis, which is the inflammation of the brain, is a very common symptom and can cause mental confusion and disorientation. Just this month alone, in May 2018, it has been confirmed that 8 people have died in Kozhikode, which is located in the southern region of India. All 8 had reportedly shown symptoms beginning with a fever and had progressed to encephalitis.
NIPAH virus is a zoonotic pathogen that is a member of the Paramyxoviridae family. This family consists of single-stranded, enveloped RNA viruses. The genus of this virus is NIPAH virus. Infected bats shed the virus in their excretion and secretion, such as saliva, urine, semen, and excreta, but they are symptomless carriers. The NIPAH virus is highly contagious among pigs and can be spread by coughing. UCLA discovered that Epidemiology B2 is where the virus attaches to. Located on brain cells and cells lining the blood vessels, Epidemiology B2 is critical to the nervous system development and the growth of blood vessels in human and animal embryos. Epidemiology B2 is found in humans, horses, pigs, and bats, which may explain why the infection can spread so easily from one species to another.
As we know, humans can become infected with NIPAH virus by coming into contact with infected pigs who have been exposed to fruit contaminated with bat excretions. To prevent future outbreaks, there have been more focused efforts on surveillance of high-risk pig farms. If pigs become infected, the protocol is a mass culling, or separation and removal of infected pigs and immediate disinfection of contaminated areas and equipment. There are other important measures in place to prevent the spread of Nipah, such as placing a ban on the transportation of pigs within affected areas and also stopping pig production in regions affected. It is important to educate those at high risk of exposure to use personal protective equipment and improve hygiene at pig farms. To summarize, Nipah virus infection can be prevented by avoiding exposure to this guy and infected pigs. Also, it is best to avoid drinking raw date palm sap.
Transmission of Nipah virus may occur after direct contact with infected bats, infected pigs, or other infected people. During the initial outbreaks in Malaysia and Singapore, most human infections resulted from direct contact with respiratory secretions of sick pigs or their contaminated tissues. In the early Bangladesh and India outbreaks, the consumption of fruits or fruit products contaminated with urine or saliva from infected fruit bats was the most likely culprit. Human-to-human infection is very rare. However, during the outbreak in India in 2001, 33 health workers and hospital visitors became ill after exposure to patients hospitalized with Nipah virus illness, suggesting nosocomial infection. In general, those who work where there are infected swines and live in the countries of South Asia will be the most prone to the virus-causing agent.
Treatment of NIPAH virus infection. There are currently no vaccines or treatments approved for animal or human use. The primary treatment for human cases is intensive supportive care. However, recent modern therapeutic treatment methods have been used to contain the disease. The drug ribavirin has been shown to be effective against the virus in vitro, but have been inconclusive and ribavirin remains uncertain. Passive immunization using human monoclonal antibody targeting the NIPAH G glycoprotein has been evaluated in post-exposure therapy and found to be of benefit in treating the virus.